Hi, this is Dr. David Zahalik, and I have an update for you on the swine flu. Today is Tuesday, April the 28th, and as of today, there are 64 confirmed cases of swine flu in the United States. Now, swine flu is a version of the influenza A virus. The current strain that there's an outbreak of is the H1N1 strain. Not that that's clinically that important, but it's got elements of bird flu and of swine flu and of regular influenza that affects human in it. Now, the problem with these flu viruses is that they mutate rapidly, and so they can become a lot more aggressive and virulent, or they can just peter out. So nobody knows yet how aggressive and how swiftly that this particular strain of the virus is going to spread and affect humans. Now, to put it into some perspective, there was actually an outbreak of flu in the Philippines in 2007, and we didn't hear that much about it. It's said that the overall mortality of swine flu is 10%, or is less than 10%. But, we have 64 confirmed cases in the U.S. and so far no deaths. And so that's a good sign. Now, people are more disposed to having complications of the flu if they have underlying sickness. For example, if they have heart or lung disease or immune system problems, or if they don't have access to health care. What are the symptoms of swine flu? Well, they're the symptoms of the usual flu. That would be things like headaches, body aches, fatigue, sore throat, fever, congestion, decreased appetite, and sometimes vomiting and diarrhea. The virus lives in the secretions of the nose and mouth, so not surprisingly, it's spread by coughing and sneezing. It's not spread by eating pork products, so it's not spread by eating ham or bacon. It is spread from pigs to humans, typically to the workers that work with pigs, especially if the area is not that well ventilated. Now, the virus is contagious for the first 5 days of the infection and up to 10 days, and more commonly in kids it can be spread for the full 10 days. The key to containing this virus is early identification, and that means three things. Number one, if you're symptomatic, so if you feel flu-like, feverish, headache, achy, weak, sore throat, nasal congestion, cough, you should be seen early for determination to know whether you should be on antibiotics or not. Secondly, don't go to work or to school or take mass transit if you're sick. If you're sick with swine flu and you get on a plane with 300 other people, there's going to be a major propagation of the virus. So resist that temptation to do that. And third is be fastidious about things like hand washing, sharing cups and utensils, and just sharing the close space of someone who's sick. Generally speaking, you want to stay more than 6 feet away from somebody who seems to be ill with these kind of symptoms. Now, if you come to our office and you have symptoms that make us think you might have swine flu, what we'll do is a flu test. We'll test you for the influenza A virus. If you test positive for influenza A virus, that doesn't mean you have swine flu. It means we'll take a viral swab and send it to the health department for confirmatory testing. So it means you might, if you have the test in our office positive, you might have swine flu, but it needs to be confirmed. If you test negative for influenza A in our office, it means you don't have swine flu. Now, if you do have swine flu, we use antibiotics. And we like to use them within 2 days of the onset of symptoms because they work a lot better then. You can definitely decrease the severity of the illness and the spread of somebody who's got swine flu if you give them antibiotics in the first 48 hours. After that, they don't work nearly as well. Now, there's a important group to think about when you're thinking about antiviral antibiotics, and that's pregnant women. It's known that Tamiflu and Relenza and drugs of that class may be toxic to a fetus and embryo, so pregnant women only receive antiviral antibiotics with great consideration and thought given to the risks both to the fetus and to the mother. So that's your update on swine flu. If you have symptoms, I recommend you be seen and evaluated. I recommend you don't go to school, work, or mass transit, and wash your hands more and take care to avoid sick people for a little while. Hopefully this epidemic or outbreak, I guess is more correct right now, will quickly die down. That's our hope. We'll keep you informed.